For most Kenyans, the high cost of healthcare has remained a critical barrier to accessing quality and timely healthcare services. Healthcare expenses account for a significant chunk of total household expenses in Kenya, making it almost impossible for the individuals in the lower income bracket to access much needed healthcare services.
It is not a question of prices of drugs going up. Prices of drugs in reality have actually come down over the last 5 years, especially with the entrance of generics from countries like India. What has actually gone up is the issue of tests, quality, diagnostic tests.
Even as the government grapples with the problems of affordable healthcare, the costs have continued to escalate.
Our wish is to be able to provide affordable care to our people. But let me underscore that there is a quality tied to it, and we know quality costs money.
It's not a question that the government is not committed to it. The issue is competing priorities, right? Education, we decided to go and give free universal primary education. We are going for secondary. So it has taken up resources from other sectors, including the health sector towards the education sector. So there is intense lobbying with the Treasury for the health sector to get more money.
5 years ago, Kenya was on the verge of introducing the National Social Health Insurance Scheme, but this is yet to take place due to failure to agree on a system which will guarantee affordable health care.
I think there is room for National Social Health Scheme, but the approach and introduction is what I think needs to be relooked and examined and widely discussed, so that at the end of the day, we do not start a scheme which is going to fail, which is going to disenfranchise most of our citizens. It's going to give hope, but it will not be implemented appropriately.
Currently, public hospitals in Kenya are operating a cost-sharing system that has nevertheless put a huge strain on the hospitals. One of the most affected is the country's biggest referral hospital, Kenyatta National Hospital.
The question is it a good idea? The answer is a good idea. Is it sustainable? It may be a serious challenge, because I think Kenyans are getting poorer and poorer every now and then. And so the first thing is, since we are not static, is to ask what is it we can do to improve on the model of cost sharing, so that the hospital has enough funds for operations and maintenance.
The persistent underfinancing of the health sector has dramatically reduced the government's ability to ensure the provision of quality, adequate, and sustainable healthcare services to its citizens.
Vision 2030 is very clear that in the social sector, what you call the social pillar, health is one of the most important aspects, and therefore the issue of whether we can be able to attain international standards of healthcare delivery in terms of specialized healthcare. Really, if we want that to happen and for us to attract patients in the greater region and talk about medical tourism, and particularly to the government institutions.
The demand for quality health services has seen the emergence of private hospitals in addition to the government's public facilities, and these are now playing a key role in provision of health services to Kenyans, albeit at an even higher cost.
In my view, there's an element of how do we handle the resources which are available to make cost of care affordable. Secondly, I think there's still room for the government to be able to address some of the legal framework which exists for supplies of medical supplies, the inputs which we put into the care of patients.
A key success for the government in the healthcare sector has been in its implementation of a distribution system that effectively and efficiently delivers medical commodities to all public health facilities.
To effectively ensure that the medicines are properly distributed and they reach the facilities where they're intended, we used outsourced transport. We have outsourced private transport for each and every region in this country. By so doing, we're ensuring that we have unlimited distribution capacity. We are able to distribute Capacity to transport the medicine is not a limitation. We have a large team of field officers. In fact, that is the biggest department in this organization in terms of human resource, in terms of resources. These people are mobile, they are all pharmacists, and they are in all the provinces.
While the achievement of the right to health directly depends on the government's financial decisions, employers have seen huge increases in their medical costs, and health insurance providers are providing options on ways they can cut on these costs.
If you look at the way medical bills are being paid, it is estimated that about close to 60-70%, I think it's close to 65%, is out of pocket. People pay when they get sick and they go and pay for that ailment. Therefore, there's no planning. Now, if you look at the way healthcare works, especially what you call the managed care, it has two arms. One is what you call the financing, and the other side is the delivery. The financing is how you put the funds. The other side is to make sure that there's a delivery system to deliver healthcare.
Evidently, every citizen has the right to the highest attainable standard of health. Much more concrete efforts are also needed if Kenya is to achieve universal and affordable healthcare for all.